Asepsis is the state of being free from harmful microorganisms, such as bacteria, viruses, and fungi, that can cause infection. It is the cornerstone of safe healthcare delivery, protecting both patients and healthcare professionals. Aseptic techniques encompass all procedures and practices employed to eliminate or minimize the presence and spread of these potentially infectious agents. From routine wound care to complex surgical procedures, asepsis plays a vital role in preventing healthcare-associated infections, or HAIs, and ensuring positive patient outcomes. By implementing aseptic principles, healthcare professionals create a controlled environment that minimizes the risk of infection. This involves not only eliminating existing contamination, but also preventing the introduction of new contaminants. Effective infection control practices, rooted in the principles of asepsis, help to reduce the incidence of HAIs. The understanding and practice of asepsis as we know it today is the culmination of centuries of scientific inquiry and medical advancements. From the rudimentary practices of ancient civilizations to the sophisticated techniques of modern medicine, the journey has been long and transformative. Key figures throughout history have made remarkable contributions, transforming medical practice and significantly improving patient outcomes. Their relentless pursuit of knowledge and innovation laid the foundation for the medical standards we uphold today. Ignaz Semmelweis, a Hungarian physician working in Vienna in the mid-19th century, was a pioneer of hand hygiene. His observations and interventions were groundbreaking at a time when the concept of germs was not yet fully understood. He observed a high mortality rate from puerperal fever in maternity wards, and hypothesized that medical students carrying cadaverous particles from autopsies were responsible for the spread of the disease. This was a revolutionary idea that challenged the medical norms of his time. Semmelweis implemented hand washing with chlorinated lime solution, which dramatically reduced mortality rates. His insistence on cleanliness and hygiene practices paved the way for future advancements in infection control. Louis Pasteur, a French chemist and microbiologist, revolutionized our understanding of germs and their role in disease. His meticulous experiments and discoveries were instrumental in shaping modern microbiology. His work disproved the theory of spontaneous generation and established the germ theory of disease. This breakthrough provided a scientific basis for understanding how infections spread and how they could be controlled. Joseph Lister, an English surgeon, applied Pasteur's germ theory to surgical practice, introducing the use of carbolic acid as an antiseptic agent. His methods significantly reduced post-operative infections and transformed surgical procedures. Robert Koch, a German physician and microbiologist, furthered our understanding of the link between specific microorganisms and specific diseases. His work in identifying the causative agents of diseases like tuberculosis and cholera was pivotal in the development of modern bacteriology. Asepsis is paramount in ensuring patient safety and effective infection control. Every healthcare interaction carries a potential risk of introducing or spreading microorganisms. For patients, aseptic techniques are crucial in preventing healthcare-associated infections, or HAIs. By adhering to aseptic principles, healthcare professionals can significantly reduce the incidence of HAIs, protecting vulnerable patients from preventable infections. Asepsis also plays a vital role in protecting healthcare workers. By implementing aseptic techniques, healthcare workers minimize their own exposure to these potential hazards. Sterile instruments, equipment, and environments are crucial for ensuring that procedures are performed safely and effectively. Aseptic techniques are not limited to a single department or procedure, they are woven into the fabric of healthcare delivery across various settings. Operating rooms, or ORs, are environments where aseptic technique is paramount. Surgical procedures involve breaching the body's natural barriers, making patients highly susceptible to infection. Intensive care units, or ICUs, house critically ill patients with compromised immune systems, making them particularly vulnerable to infections. Wound care, whether in a hospital, clinic, or home setting, relies heavily on aseptic techniques. Even in seemingly routine procedures, such as administering injections or inserting intravenous catheters, aseptic technique is essential. By adhering to aseptic principles, healthcare professionals minimize the risk of introducing infection at these vulnerable sites. Section 5. The 5 Pillars of Aseptic Technique. Maintaining asepsis relies on a set of core principles that guide practice and ensure a consistent approach to infection control. These principles are essential in preventing healthcare-associated infections and ensuring patient safety. Hand hygiene is the single most effective way to prevent the spread of infection. It is the cornerstone of aseptic technique and must be performed meticulously. Thorough hand washing with soap and water or using an alcohol-based hand sanitizer before and after each patient contact is crucial. This simple yet effective practice can significantly reduce the transmission of pathogens. Personal protective equipment, or PPE, acts as a barrier between healthcare workers and potential sources of infection. Proper use of PPE, including gloves, masks, gowns, and eye protection, is vital in maintaining a safe environment. Creating and maintaining a sterile field is paramount during invasive procedures. This involves using sterile drapes, instruments, and maintaining a controlled environment to prevent contamination. Handling sterile items requires meticulous care to prevent contamination. Healthcare workers must be trained to handle these items correctly to ensure they remain sterile throughout the procedure. Sterile objects should only be touched with sterile gloves, and contact with non-sterile surfaces should be avoided. This practice helps maintain the integrity of the sterile field. Regular cleaning and disinfection of surfaces, proper waste management, and appropriate air ventilation are crucial for minimizing the risk of infection. These measures ensure that the healthcare environment remains safe for both patients and staff. Section 6. Maintaining the sterile field key parts, key sites. The concept of a sterile field is central to aseptic technique, particularly in surgical and other invasive procedures. Key parts refer to areas of a sterile gown or drape that are considered sterile. These typically include the front of the gown from chest to waist level and the sleeves from the elbow to the cuff. Key sites are areas on a patient's body or on medical equipment that are considered sterile after preparation with an antiseptic solution. Maintaining the sterile field requires constant vigilance and adherence to aseptic principles. Any breach in sterility, such as a tear in a glove or contact with a non-sterile object, must be addressed immediately to prevent contamination. Section 7. Asepsis and the battle against antimicrobial resistance. Asepsis plays a critical role in the fight against antimicrobial resistance, a growing global health threat. Overuse and misuse of antibiotics and other antimicrobial agents are major contributors to the development and spread of antimicrobial resistance. Asepsis, by preventing infections in the first place, reduces the need for antibiotics and other antimicrobial agents. By minimizing the use of these medications, we slow down the development and spread of resistance. By adhering to strict infection control practices, healthcare professionals can break the chain of transmission and prevent resistant organisms from spreading from one patient to another. Section 8. The future of asepsis. Advancements and challenges. As medical technology advances and healthcare delivery evolves, the field of asepsis continues to adapt and innovate. The integration of cutting-edge technology into healthcare settings is revolutionizing the way we approach infection control and patient care. New technologies and approaches are constantly being developed to further minimize the risk of infection and improve patient outcomes. From advanced diagnostic tools to innovative treatment methods, the landscape of asepsis is ever-changing. One area of advancement is in the development of novel antimicrobial surfaces and materials. These innovations are designed to reduce the presence of harmful microorganisms on medical equipment and in healthcare environments. Robotics and automation are also playing an increasing role in enhancing aseptic technique. Automated systems can perform tasks with precision and consistency, reducing the risk of human error and contamination. Despite these advancements, challenges remain in ensuring consistent adherence to aseptic principles. Human factors such as fatigue and workload can impact the effectiveness of aseptic practices. Ongoing education and training for healthcare professionals are essential to reinforce the importance of aseptic technique and to ensure that best practices are followed consistently. Regular training sessions and updates on the latest protocols are crucial. As new microorganisms emerge and existing ones develop resistance to current treatments, healthcare systems must adapt their infection control practices to effectively address these threats. Continuous research and adaptation are key to staying ahead of these evolving challenges. Section 9. Conclusion. Asepsis, a cornerstone of quality healthcare. Asepsis is not merely a set of procedures but a fundamental principle that underpins the very foundation of safe and effective healthcare delivery. From the pioneering work of Semmelweis, Pasteur, Lister and Koch to the latest advancements in antimicrobial technology, the pursuit of asepsis has driven progress in medicine and saved countless lives. The emergence of new pathogens, the rise of antimicrobial resistance, and the increasing complexity of medical procedures demand constant vigilance and adaptation. By embracing a culture of asepsis, healthcare professionals at all levels can contribute to creating a safer healthcare environment for both patients and themselves. Asepsis, in its essence, is a testament to the profound responsibility we have as healthcare professionals to protect and preserve life.